Depression, it's a word we hear often, but what does it truly mean? Depression is a serious mental health disorder. It affects millions of people worldwide, making it a leading cause of disability. In the United States alone, almost 10% of adults experience depression. It's important to understand that depression is not just feeling sad. Sadness is a normal human emotion. We all experience it from time to time. It's often triggered by a specific event and fades with time. Clinical depression is different. It's a medical condition characterized by persistent low mood and loss of interest in things you used to enjoy. This state of despair lasts for at least 2 weeks and significantly impacts daily life. The distinction is crucial. If you're feeling down for an extended period, don't brush it off as just a rough patch. Seek professional help. Depression isn't just in your head, it physically affects the brain. Research shows that people with depression often have smaller frontal lobes and hippocampi, areas crucial for emotional regulation and memory. Think of your brain as a complex network of communication lines. These lines transmit signals using chemical messengers called neurotransmitters. Depression disrupts this communication. Serotonin, dopamine, and norepinephrine are key neurotransmitters involved in mood, motivation, and pleasure. In depression, their levels are often imbalanced. This chemical imbalance contributes to the persistent feelings of sadness, hopelessness, and lack of energy. What causes depression? It's a complex interplay of genetic predisposition and environmental factors. While scientists are still unraveling the exact mechanisms, it's clear that there's no single cause. Family history of depression, traumatic life events, chronic stress, and even certain medical conditions can increase the risk. Sadly, even with advancements in research, we can't predict who will develop depression with absolute certainty. Adding to the complexity is the delay in seeking help. On average, people with mental illnesses, including depression, wait over a decade before reaching out for support. This delay is often due to stigma, lack of awareness, and the misconception that they should be able to snap out of it. There's hope. Depression is treatable. Just as you'd seek help for a physical ailment, it's crucial to address mental health concerns. Medications such as antidepressants can help restore the balance of neurotransmitters in the brain. Therapy, particularly cognitive behavioral therapy, equips individuals with coping mechanisms and helps reframe negative thought patterns. In some cases, other treatment modalities like electroconvulsive therapy or transcranial magnetic stimulation might be considered. Remember, finding the right treatment plan is a collaborative effort between the individual and a qualified healthcare professional. If you know someone struggling with depression, offer support. Encourage them to seek help. Sometimes the simplest acts of kindness, like listening without judgment or helping them find a therapist, can make a world of difference. Remember, depression is not a weakness, it's a medical condition, not a character flaw. By fostering open conversations about mental health, we can reduce stigma and encourage more people to seek the help they deserve. You're not alone.